Have you ever felt like your thinking ability is slow or unclear? You might be going through what people commonly call brain fog. While it's not an official medical term, it refers to a temporary feeling of decreased mental sharpness. The concept of brain fog has likely been around as long as humans have had intelligence. However, the recent rise of burnout culture, which has led to many people being overworked, has brought attention to the cognitive challenges associated with it. During the COVID-19 pandemic, some individuals began noticing a shared side effect during their recovery: lingering brain fog. Since then, more research has been conducted to gain a better understanding of this term, which is almost as vague as the feeling of brain fog itself. Definition of brain fog. The term brain fog isn't an official diagnosis given by doctors. According to Sheru Pudumji, PhD, a neuropsychologist at the Cleveland Clinic Lou Ruvo Center for Brain Health in Las Vegas, it's a broad term used to talk about common cognitive symptoms. These symptoms can differ, but typically involve the feeling that your thinking or memory is not as sharp or effective as it once was. History of brain fog. The term brain fog is believed to have originated from brain fag, a phrase coined in 1850 by British physician James Tunstall, according to research. Tunstall used this term to explain the mental exhaustion faced by brain workers like lawyers, writers, teachers, and students due to excessive studying. In the 1960s, brain fag syndrome was included in the DSM-4, Diagnostic and Statistical Manual of Mental Disorders, to characterize excessive academic strain, as per research. Today, even though the terminology has evolved, brain fog is now used to describe symptoms linked to various medical conditions and as a result of burnout and excessive workload in contemporary society. Potential signs and symptoms of brain fog. Dr. Pudumji explains that brain fog shows up as cognitive inefficiencies, meaning you're having a hard time accessing your cognitive abilities as effectively as before. You might face difficulties with attention, concentration, learning, short-term memory. How this shows up can vary among individuals, but based on insights from Pudumji and Danielle Willow, Maryland, an assistant professor in neurology at the University of Colorado School of Medicine in Denver, here are some experiences you might have due to brain fog. Struggling with multitasking, finding it harder to understand concepts or learn compared to before. Words being on the tip of your tongue but difficult to recall, feeling like you're in a dream or trance, entering a room and forgetting the task you set out to do, forgetting details of conversations, absorbing content less effectively, getting easily sidetracked or distracted. Pudumji also notes that patients often describe an overall sense of cognitive sluggishness. A study examining the use of the term brain fog in Reddit posts found that people use various descriptors like dissociation, fatigue, forgetfulness, and excessive cognitive effort to convey this experience. These symptoms collectively contribute to the sensation that your thinking is unclear. Possible causes of brain fog. Identifying the reasons behind brain fog is tricky because there are numerous potential causes, and simply experiencing brain fog doesn't provide doctors with specific information about what might be happening. However, here are a few typical factors to keep in mind. Hormonal changes. According to Dr. Willauer, both menopause and pregnancy can contribute to brain fog. Studies indicate that pregnant individuals may experience confusion, disorientation, and fogginess, leading to behaviors like putting things in unusual places, misplacing belongings, and forgetting simple work tasks, commonly referred to as pregnancy brain. In the case of menopause, a study suggests that memory difficulties can start early in the menopausal period and continue into postmenopause. This is likely influenced by the impact of estrogen on memory performance. Diet challenges. If you're following a limited diet and not getting enough vitamins and minerals, it could lead to experiencing some brain fog, according to Pudamji. Specifically, a lack of B12 or iron may cause anemia, lowering energy levels and indirectly affecting cognition, as explained by Willard. Moreover, changes in your cognitive abilities can occur due to food allergies and sensitivities, notes Willard. Beyond Celiac reports that 95% of individuals with non-celiac gluten sensitivity, based on their research, mention experiencing brain fog. Using medication may lead to side effects associated with brain fog. For instance, taking Topamax, a medication for migraines, can make you feel mentally unclear. According to Willauer, patients are cautioned that it can cause foggy thinking, confusion, and difficulty finding words. Additionally, taking multiple medications known as polypharmacy can also contribute to brain fog, she adds. Side effects vary among individuals, but if you've observed brain fog after starting a new medication, it's advisable to consult your doctor or pharmacist to inquire about possible cognitive effects. Remember not to stop taking prescribed medication without consulting your physician first. Chemotherapy. The term chemo brain refers to thinking difficulties that can occur before, during, and after cancer treatment, as stated by the National Cancer Institute. This mental fog can arise from the cancer itself, conditions resulting from cancer, like depression or sleep issues, or various treatments such as chemotherapy, radiation, and hormone therapy. Certain medical conditions. According to Willard, brain fog can be associated with various medical conditions, including postural orthostatic tachycardia syndrome, anemia, diabetes, depression, anxiety, and autoimmune disorders like multiple sclerosis, chronic fatigue syndrome, celiac disease, and lupus. One common health issue linked to cognitive difficulties is hyperthyroidism, an underactive thyroid that affects 5% of Americans older than 12, according to the National Institute of Diabetes and Digestive and Kidney Diseases. Research indicates that fatigue, depression, and memory and executive function challenges often serve as early signs of hypothyroidism. In a separate note, studies suggest that individuals with mild cognitive impairment, MCI, may be more prone to developing Alzheimer's disease or dementia compared to those without MCI, according to the National Institute on Aging. While approximately 10 to 20% of people aged 65 and older with MCI may progress to dementia over a year, ongoing research aims to understand why some individuals with MCI advance to dementia while others do not. COVID-19. COVID-19 is recognized for causing lasting issues with attention, concentration, and memory following infection, which is a symptom of long COVID, as stated by the National Institutes of Health, NIH. NIH-supported research suggests that this could be attributed to brain inflammation affecting the behavior of brain cells. In a particular study, 7.2% of individuals with long COVID reported experiencing brain fog, and this symptom was more prevalent among women, those with pre-existing respiratory issues, and those who had a severe case of COVID-19. Moreover, as highlighted in an article in The Guardian, several neuroscientists and behavioral experts suggest that the trauma and isolation experienced by some people during pandemic-related lockdowns may also contribute to brain fog.